Welcome back to Tony's tutorial. Today we are going to discuss a very important topic in biomechanics which has a great implication in your professional and personal life. You might have seen people walking with a cane on right side or left side, especially people who are old aged or people who have some hip arthritis or knee arthritis, etc. In your clinical life, you might have wondered where should I exactly refer the patient to have the cane. Should it be on the right side? Should it be on the left side? Or should I prescribe it at all? I know that many of us know the answers, but do we know the biomechanical reason for that? Can we correlate it biomechanically and theoretically that this is the ideal position? If you want to know the answer, listen to this lecture. But if you are a common person, and a professional who don't want the theoretical knowledge, theoretical basis, and just want to know the answer, check back the last 5 minutes in this video. This is Tony's tutorial, and today we have the biomechanics class on using of the cane. Today we are going to discuss, as I told, about the utilization of a cane. And before that, I want to remind you, we were discussing about the unilateral stance. In unilateral stance, due to our calculations, we had a person weighing 120 Newton or kg, whatever it is. Actually 120 kg may be around 1000 and greater than 1000 Newton, but we don't want to calculate. We don't want to go back with the mathematics. We just want to know the theoretical knowledge. Okay, just let us take it as 120 Newton or 120 kg. Now here we want to know that what is the force, what is the total joint compression in that patient. And we saw that after our calculation, the total compression is always the compression due to body weight plus the compression due to the abductor muscle activity. And that was around 3 times the body weight compression. 3 times the total body weight compression. So unilateral stance, the person, if for example, if I'm the first patient with my right leg pain and if I'm standing in the unilateral phase, the compression in my joint is 3 times than the body weight compression in bilateral stance. So if there is a greater joint compression, what do you mean by joint compression? The compressive force that is acting on the head of the femur and the articular surface. If that is going to be higher, exactly what happens, there will be greater pain. The patient may not be able to bear that pain. It will be disadvantageous. So unilateral stance is very difficult for a patient. Now, why should we discuss about a unilateral stance? Let him walk with bilateral stance. Why should he walk with unilateral stance? The answer is that not just an amputic patient or an accident patient or road traffic accident patient, but daily life. We are having unilateral stance in our gait. When we are walking, there is a phase after which our leg, one of the leg will be above the ground. Then after next cycle, the next leg will be above the ground. So daily life, we are moving through the unilateral stance. So in patients, this is important. Why this is important? Because in daily life, the patients need to walk. When patients are walking, they are constantly going in unilateral phase, one leg on the ground, either single limb support time. So at that time, there will be excessive pain in the limb. So how to solve it? That is what we have to discuss. And now we have a peculiar patient called X, a 70-year-old patient. You know that surgery is not going to give him relief, and he is not in a physically fit condition to go for surgery for his hip arthroplasty, total hip arthroplasty or knee arthroplasty. He came to your physiotherapy clinic and you want to give him a solution. What is the solution? How can you rehabilitate him? There are 3 possible means of rehabilitation. That is, I told you, every day in your gait cycle you have to go for the unilateral stance. So in bilateral stance, when your patient is walking, for example, if the patient is making 2 steps, during bilateral phase you may not have the pain. He may not have a pain exaggerated. When he is having exaggerated pain, when there is a unilateral phase, at that time, if his right hip is the weight bearing hip, then he will have pain. For example, if this patient X is having right hip pain and he is walking in second phase, what happens is left foot will get out from the ground, off from the ground. Then the entire weight will be on the right foot for a light, simple, for a negligible time. But that time the pain will be exaggerated. So you have to rehabilitate him. Now, what are the possible means of rehabilitation? I would tell we have three possible means. At least four, but three systematic means of rehabilitation. The first one you might have known. The patient X comes to your clinic like this. He will be coming to your clinic like this, limping on the one side, leaning on to the one side. He will be coming like this. He has a right hip pain and he will be coming to your clinic like this. And when you see the patient in your clinic, you might tell him, no, don't bend to that side. You have pain in that side. How can you bend to that side? And after treatment, after some modalities to decrease the pain and some exercise, you ask the patient, mister, don't bend to this side today onwards. You should not bend to your side. Your body weight will exaggerate your pain, so don't bend to that side. Walk straight or bend to the opposite side. Very good. The doctor is a professional person. He has great knowledge. So I don't walk on that side. The patient will go to the home, either walking like this. Patient will come to you next day, or he will call you in the midnight and will tell, I have a great increase in pain. You will tell him that it's okay. It's just because you are going for the treatment, you will get relief. The same phenomenon will repeat 2 or 3 times, or maybe a week. Then you will tell the patient again that it is not a problem. It will decrease. Finally, next day you won't see the patient. That's what's going to happen. Let it not happen. Here, my dear friends, what is the thing? When the patient was coming to you leaning to his side, that was natural defense mechanism, natural compensatory mechanism by the patient to decrease his pain. If we are not able to understand that, we must check back our knowledge. So the first method to decrease weight bearing or hip joint compression in unilateral phase is compensatory lean. Compensatory lean on same side. Compensatory lean on the same side. What do you mean by compensatory lean? The patient is having right hip pain. Now during the unilateral phase of the gait or during his gait, you ask the patient to lean onto his right side. Again, that sounds heck for you, because you might think that he is having pain on the right side. Why should he bend to the right side? Of course, I don't deny the fact that there is increased weight transmission to the right side. But if you look mathematically or biomechanically, you will see that that is advantageous to him. Let us see why. We know that the total hip joint compression is a combination of body weight compression plus the abductor muscle work. Now, we calculated the abductor muscle work, but by first understanding what was the adductor torque. If you haven't listened to the last class, this sounds difficult, check back to my video, the link is given. And one more thing, if you haven't subscribed to my channel, please do subscribe. I just forgot to mention that. And now let us move on. The torque, abductor torque, we found out by comparing it with the adductor torque. We know that the adductor muscle, when the patient is standing in his right leg, when the patient is standing in his right leg, what is happening? There is a tendency to fall on like this. So fall on to this side. This will produce adduction in this right hip. Adduction in this right hip, that is the gravitational adduction due to the body weight, gravitational adduction in this hip. This has to be balanced by something over here, that is the right abductors. So the right abductors will be working against that. So we need to find out what is the force of contraction of right abductors. We found out by comparing or finding out from the gravitational adduction torque. If gravitational adduction torque was, you say 10 Newton, the abductor torque should be 10 Newton. So we know the 10 Newton, now we can find out the force of abductor muscle contraction. And when we find out the abductor muscle contraction plus the body weight is the total hip joint compression. That was the picture. Now here you see the patient, for example, this is, let it be his imaginary hip joint. Okay, you have the head over here, right? You had the head over here. Now you see, this was the situation. You know that this is the head of the femur and this is the momentum. This is momentum on right side and this is the momentum on left side. Momentum on the left side. Now the patient is walking on his right side. What I will ask my patient to do, I will ask my patient to lean onto this side. When I am leaning onto this side, what I am doing is, always you know that center of gravity, line of gravity passes to the center of the body. Line of gravity passes through center of mass of your body. When you are leaning to this side, the total joint weight, the total body weight comes to this side. When body weight comes to this side, the line of gravity will move near to the hip joint. You see, this line of gravity will move like this and it will reach near to the hip joint. When it is near to the hip joint, this momentum is less than this momentum, right? So when you are leaning to one side, what you are doing is you are shifting your body weight. When your body weight is shifting, greater part of the mass is on this side, and when greater part of the mass is on this side, the line of gravity changes near to the hip joint, right? Now the momentum decreases. And now we know how to calculate the adductor torque, the torque generated by adduction on this hip. Adductor torque is equal to force into momentum. You know what was the force? That is the body weight acting on here. Body weight acting was 5/6 the body weight. Body weight of the head, arm and trunk plus this limb. That is 5/6 the body weight into momentum, which we had if the patient is 120 Newton or 120 kg, which will equal to 100 Newton. Okay, 100 into momentum. You say this momentum was 0.1 meter or 10 centimeter. Now this momentum decreases. For example, you take it as 0.25 meter, 0.25 meter, okay, or 2.5 centimeter, 0.25 meter. Now if you calculate, you will get the answer as 2.5 Newton meter. See, the momentum was 2.5 Newton meter. In this earlier example, which was like this, adductor torque in unilateral stance, adductor torque was equal to force into momentum. The force was how many Newton? The same 100 kg itself into the momentum. What was the momentum? 0.1, which you get it as 10 Newton meter. So this is 10 Newton meter. Here the torque is 2.5 Newton meter. That gives you the total abductor torque. So our task is always to find out the abductor torque. This is the gravitational adduction torque. This torque that is acting. Now you need to find out the abductor torque. Abductor torque equal to force into momentum. You know that abductor torque is acting against this adductor torque. For example, when I am bending like this adduction torque is balanced by my abductors. So that will be equal. Adductor torque equal to abductor torque. That is 2.5 equal to force into momentum. So force is equal to 2.5 divided by momentum of the abductor muscle is 0.05. 2.5 divided by 0.25. Clear? Am I right? Okay, you will get it as 25 by 5, which is equal to 50, which is equal to 50 Newton meter. We will get it as 50 Newton meter. A momentum of the abductor muscle was 0.05. These are the things. Kg, body weight is equal to 120 Newton. Momentum of the gravity is equal to 0.1 meter. Momentum of the abductor muscle is equal to 0.05 meter. This was the general consideration. Don't forget that. That is what we are going to apply here. So that is 50. Here what was that? Here it will become 10 equal to, in this situation, force into momentum. For force is equal to 10 divided by 0.05, which is equal to 200. Here it is 50. You see the difference? So the total joint torque is 50 plus body weight 100, that is 150. Here it is 200 plus 100, which is equal to 300. You see, in unilateral stance, if the patient was not leaning onto the side, for example, the patient is having right hip pain and he is walking like this, the torque will be, the joint compression will be 300. But if he is leaning to one side, it decreases to 150. That means exactly half decrease in the joint compression. That means he is having relief. Half of the pain vanishes. See how you got this one? You know, this is like a abductor torque is equal to force and momentum. Abductor torque would be counterbalancing the adductor torque. So you can equate that and you do the calculation, you get it as 50. Total joint compression is this 50 plus the total body weight, that is 150. Here that is the 300. So when a patient is leaning to the side, well, either to the painful side, he is actually having 50%, about 50% of decrease in pain. Now you can bend in such a way that you can even bring this one to the hip joint, like you can bend this much. Now if you bend this much, the abductor torque is almost zero. Only body weight will be there, like unilateral sense. But can you do like this? No. This is tough, because when you are bending to one side, it is altering your body biomechanics. You are going for wear and tear in your lumbar spine. Lumbar spine, it is getting what? Increased pressure, compression, and so on. You are going to for the tilt in the pelvis and total structural abnormality. So that is the problem. We can even get the momentum of zero by leaning maximum to the side, but our body posture will change, spine arrangement will change, everything will change. So that is the drawback of this compensatory lean. When you are leaning like this, you have to adopt various compensatory strategy in the body. That will require muscle work. So for maintaining the spine like this, muscles has to work. For maintaining the muscle, for maintaining the extensibility of this muscle has to work. Here the muscle has to contract. So that will produce more energy expenditure. That will require more energy expenditure. More energy expenditure, body won't favor that. So this is not a very favorable solution for decreasing the pain. Okay, so that is the drawback. The drawback of compensatory lean, even though it is decreasing pain by 50%, is that it will create structural abnormality, it will create lumbar spine problem, etc. So we won't advise it to the greatest. You can ask the patient to walk with some other strategies. What is that strategy? What is the next strategy that we will ask our patient to do? That is what we are coming into. That is the utilization of this one, the cane. This is my grandmother's cane. I just borrowed it for the time being. That is the utilization of a cane or a stick. You have two ways of utilization. You can either use the cane on the painful side or on the opposite side. This is known as ipsilateral utilization. This is known as contralateral utilization. So you can advise the patient to have cane, contralateral, ipsilaterally or contralaterally. That is on the same side or opposite side. Now we need to know which of this is advantageous, contralateral or ipsilateral use. Let us first move on to the ipsilateral cane utilization. Ipsilateral cane utilization. Ipsilateral cane utilization. This is very simple. When you are utilizing a cane, or when I am leaning onto this pillar over here, wall over here, what I am actually doing, I am transferring a percentage of my body weight to this side. If you want to experience this, just lean onto any board or any wall in your room. Just do that and experience. See, now I am feeling great relief in my left hip. When I am placing my hand on this side, I am feeling a great relief on my right side. That means you are transferring some of your weight to your cane. So some of the body weight is being transferred to the cane, right? And now studies shows that you can transfer up to 15%, 1/5 of body weight. Maximum you can transfer up to 15% without any damage. You can transfer 100% like this, but that is a disadvantage. But usually you can transfer up to 15% to the cane. Now let us see what happens, or is it advantageous or disadvantages if I am transferring 15% of body weight to the cane in ipsilateral side. That is, the patient is the same, he's having right hip pain and he is utilizing cane on the right side. Going back to our mathematical calculation. Let us see the compression due to body weight. Compression due to body weight. This was 5/6 the body weight, right? 5/6 of the body weight. Now 15% of that will be transferred to the cane. So we should minus that 15% from the 5/6. 5/6 of the body weight, that is, we got it as 100 Newton minus, okay, 120 is, we have the body weight as 120. We need to calculate 15% of 120. You will get it as 18. So you must minus 18 Newton, which gives us 82 Newton is the force. Am I clear? Like, you know that the body weight that is transmitted is 5/6. That is 2/3 of the HIT plus the left limb weight, because we are in unilateral stance still. Now 15% of the body weight can be transmitted by the cane. So there is a decrease in 15%. Somebody took the 15% and went. That is your cane exactly. Now you have to minus that 15%. 120 is 15% is 18 Newton. 18 Newton. So you minus 100 minus this 18, you get at 82 Newton. So the body weight compression would be only how many Newton? 82 Newton meter. Body weight compression would be only 82 Newton meter. Now we want to see, let me place my cane over here. Now we want to see the HITL torque. Okay, the torque is equal to force into momentum. The force is the body weight itself, 82 into what was the momentum of abductor, momentum of gravitational momentum. You know that you are not leaning to the side. Actually, why are you using this cane? To avoid this lean. So you are straight. When you are straight, the momentum is the old momentum in bilateral stance or unilateral stance, that is 0.1 Newton meter. So 82 into 0.1, which gives you, right, 8.2 Newton. So the force is 8.2. But in your unilateral stance, it was 10 into 0.1, which is equal to 10 Newton. Okay, here it is 8.2 Newton. This is 8.2 Newton. Now, this is to be Newton meter. This has to be balanced by your abductor muscle. The same method. The theoretical formulas are same. The gravitational torque should be balanced by your abductor muscle. So 8.2 abductor torque is equal to force into momentum. You want to find out the force. Force is equal to abductor torque divided by momentum. Right? Abductor torque is equal to 8.2. Okay? Divided by the momentum of the abductors always is equal. That is 0.05. How much you will get? You will get it as 164 Newton meter. You will get it as 164 Newton meter. Now what is the total joint compression? Total compression is equal to compression due to body weight plus abductor compression. That is, compression due to body weight is 100. You know that it is 100 plus, sorry, it is 82 plus 164. That is equal to 614 to 246. That is equal to 246. That is equal to 246. But in unilateral stance it was how many? 300. Here it is only 246. That means about 80%, 88% of this one. So there is, if you are utilizing a cane in the ipsilateral side, we can reduce pain, but only to a less extent. Only slight relief in the pain will be there. So if you are watching this video and if you have been utilizing the cane on the side, or if anybody, if your granny was utilizing, a grandfather or grandmother was utilizing cane on the side, ask them to change it. That is the better way. Let us see the mathematical calculation for that, and then we can arrive at a conclusion. So comparing this, leaning to the side was better, but this side is not going to have any benefit. Now, so ipsilateral cane utilization is not going to benefit you in a great manner. It can reduce, but it is better than unilateral stance. It is better than standing this like alone like this, but it is not greatly advantageous than this. It is not advantageous than using in the cane of opposite side. Is it true or am I right or not? Let us check it. Now the next one, the last method is contralateral cane utilization. Contralateral cane utilization. Now contralateral means you are changing the side. You have the pain on the right side, you are actually passing the cane on the opposite side. The same thing, you are just changing the cane on this side. What is the utilization of the cane? Even if you are using this side or this side, it will help in reducing the body weight by 15%. So it will reduce the body weight by exactly the same 15%. Right? Nothing more than that, nothing less than that. Now let us calculate the HATL torque. HATL torque is equal to force into momentum. Okay? Force is actually how many? 15 you should reduce from the body weight. Force is actually 5/6 of the body weight minus this 15% into momentum. Okay, 5/6 of the body weight, we know that it is 100 minus 18. 120 is 15% into momentum, which is equal to 82 into 0.1, which is equal to 8.2 Newton, which is equal to 8. The same 8.2. The momentum is not changing because we are speaking about the momentum of adductor, gravitational adduction momentum on the right hip. This momentum acting on your painful hip we are going to describe. The gravitational adduction, not the abduction momentum, gravitational adduction momentum. So momentum is same. So the body weight compression is the same 8.2 Newton. Now here comes the application. We know the body weight compression is 8.2 Newton. Why am I utilizing the cane on this opposite side? You know the situation like this, you are standing in unilateral stand, you are going to fall like this, okay, like this, your abductors has to work, okay. You have two ways. Let me stand in unilateral, my leg is up, left leg is up, I'm standing like this, exaggerated for you to see. I have a chance to fall like this, but I can balance it with this, see. I have a chance to fall, my abductors are working here, don't fall, they are hard working so that I don't fall. But here, if I'm not having a cane, I may fall. My abductors can compensate it, they can work again, so I'm not falling, but it is tough. But instead of that, you just try this and do. But instead of that, you just place a cane over here. The cane gives you relief, or you just lean on the wall gives you relief. So against the abductors, this cane can work, this cane can act against the abductor, or not against the abductor, the cane can act like the abductor and oppose the action of adductors. See what is my abductors doing? My abductors is acting against this adductor torque like this. They are making me stand, they are making me stand straight, right? Now, instead of this abductor working, you forget about the abductor, you remove the abductors. The same thing can be done like this, by placing the hand on the wall, or same thing can be done like placing the hand on this cane. So the cane is actually acting like the abductor against the adductor torque, gravitational adduction torque. So the cane helps in preventing the adduction torque by working against the adductors, gravitational adduction torque. So now the abductor torque is provided by this cane. Now let us see HATL torque, which is equal to 8.2 Newton meter we saw. Now we want to see the abductor torque. Abductor torque. We can't equate this both because your abductors are not working exactly. The work is done by the cane. So you have to find out the abductor torque by the cane. Abductor torque by the cane is equal to force into momentum. You know what is the force of the cane? Is your body weight, right? You are pressing this cane, that is a force on the cane. That is 18, right? Because 15% of the body weight will transfer to the cane. So that is 18. 18 into momentum of the cane. You see, cane's momentum from your right hip. Right is the weight bearing. From here to here, a greater momentum, 0.5 Newton meter. 0.5 meter. See, it is getting it as 0.5 meter. So 18 into 5. What is the value? 8 into 5, 40 is 90 Newton meter. 9 Newton meter. You get it as, you place the decimal, you get it as 9 Newton meter, which is greater than this 8.2, which is greater than your 8.2. That means even without your abductor muscles working, when you are placing your cane on the opposite side, that can balance the adductors. So total body weight compression would be, body weight compression plus abductor compression. Abductor compression is checked by this one. So abductor compression is 0. For avoiding the calculation error, you make it as 8.2 itself. So this both will be equal. Okay. That means that is 0. This is only the body weight compression due to your body weight, that is 100. So the total compression is only due to your body weight, that is 100 Newton. In earlier case it was unilateral stance, it was 300. In compensatory lean it was 150. In bilateral stance, in unilateral stance with the ipsilateral cane utilization, same side cane utilization, it was 264. But here it is just the 100, that is due to body weight. But that means utilizing the cane on the opposite side is the best way. So if you are a patient or if you are a professional, prescribe this one to your patient. Prescribe the patient that use the cane on the opposite side. That will reduce the joint compression by 50% or negligible value. But let me say you, in biomechanics we are oversimplifying the facts. Here we took that abductors need not work, but during our studies, lab studies, we have found out some activity in the gluteus medius. That is because here the trunk muscles get activated due to this, like latissimus dorsi, etc. So rather than the mathematical value, we have found experimentally that if you are utilizing the cane on the contralateral side, there is not a complete decrease in the pain or joint compression. There is about 50% of the joint compression. 50%. So you take it like 50%. Don't take it up to this much. 0 compression from the abductors. That is wrong. There is some compression by the abductors because of the action of the trunk muscles. Need not worry about that. Take it as simplified 50%. So, dear friends, if you want to summarize, if you are a patient who is on hip pain or hip pathology and you want to work in your daily life in a free manner, you want to decrease your pain, you have 3 strategies that I can advise you as a professional. The first thing is you have to lean on the side of the pain. Don't feel bad, that is the correct thing. Lean on the side of the pain. But if you are leaning too much on the side of the pain, you might have problem with your spine. If you are the patient of 70 years or 60%, if you have a spine problem also, this is spine problem too, this is going to be difficult and you may not be able to do that. So let us avoid that. Then you have a solution. You have a cane in your home, you can place your cane in the side of the pain. Don't use that. If you are using this on the same side of the pain, you are not going to have any much benefits. But if you are using this on the opposite side of the pain, you are going to have huge benefits. Up to 50% of this pain can decrease by using this on the opposite side. So take it to your mind. If you are using the cane, if you have a cane in your home or stick in your home, take it and place in the opposite side. If you have right hip pain, place in the opposite side. If you have left hip pain, place in the right side. That will reduce your body weight by 50%. And if you are adding on to that, if you are slightly bending to this side, that will again help. You. But it can create problem in your trunk. So the best thing to do is place your cane or stick on the opposite side. And it can increase your base of support. If your base of support is increasing, you have a greater chance of stability. So in geriatric patients, if you are an old age patient, you have a wide base of support, your chance of falling down is very less. If you have a very small base of support, your chance of falling is again high. So with this class, with this lecture, let us summarize. You have to utilize your cane on the opposite side, not on the same side. Walking without cane is a tremendous task, is a difficult task, Herculean task. You will have pain and it will exaggerate. If you have some shyness to utilize the cane, like you are a 60-year-old patient, oh, this is for 80, I'm not going to utilize that, and you are walking like this, that can aggravate your pain. So, the essence of this lecture is utilize the contralateral utilization of the cane. That is the best solution for pain relief from hip arthritis, OA of the knee, or any problems that is facing with the lower limb. If you can't go for the surgery or other management, this is not a medical advice. This is just a friendly advice. If you want real medical advice, do go for a medical professional or get back to me through my social media platforms. Thank you for watching to this class, and if you have liked the class, kindly click the like button and don't forget to subscribe my channel, because we are going to bring much more things like this in the next classes. Stay tuned. Thank you. And before winding up, I would like to tell, I would like to tell, there is also one more strategy, that is always we had body weight calculation, 100 Newton, 80 Newton, 88 Newton, etc. So if you can decrease your weight by 1 Newton, 1 kg or 0.5 kg, that can help you reducing the compression. So if you are a obese person, try to reduce your weight, because that will help you in reducing pain. So utilize a cane, reduce your body weight. This can give you the best result. But if you are just utilizing, just going to decrease your weight, it may not give you the tremendous result. You might have to strengthen your muscles. So if you have some excess weight, try to reduce it even a bit. Even a bit can reduce a great mathematically. So utilize the cane for the time being and reduce your body weight. For more professional advice, visit a medical professional.